Let me explain about safety huddles. It's a 10-minute discussion that we have on the ward involving as many staff as possible. The purpose of it is to try and identify those patients at highest risk of falling that day and to put in interventions to try and reduce the chances of that occurring. We introduced falls huddles after being inspired by Leeds teaching hospitals who managed to reduce their rate of inpatient falls across the elderly wards by 50%. We've done this with support from the Yorkshire and Humber Improvement Academy. It's basically a 10-minute discussion that happens on the ward every day, led by a senior clinician, involving as many people on the ward as we can, from domestic staff, therapy staff, pharmacists, junior doctors, nursing staff and the senior clinician. We basically ask how long is it since our last fall, and that number is placed on the board so that everybody can see. The ward get immediate feedback, and if anyone has fallen in the previous 24 hours, they are discussed. We identify the potential risk factors that may be for that patient and see if there's anything that we can do in terms of actions to reduce the chances of them falling in the future. This can be from medication reviews, footwear reviews, through to where they're positioned on the ward, cohorting or considering fall sensors. Since introducing the falls huddles on our ward, we've managed to reduce falls by 40% over 1 year. Since starting the falls huddles on Jervaulx Ward at Harrogate Hospital, 4 more wards have become involved. We've demonstrated a reduction in falls across the trust. I would encourage anyone wanting to improve the safety culture on their ward to get on with it. It's easy to do, it takes 10 minutes a day, and it can reduce harm to your patients.